Hi everyone, I'm Alex.
I'm David.
And we're here to talk about what you should see your 12-month-old doing at this stage in their development.
Now, when talking about social emotional at 12 months, your baby might cry when dad or mom leaves. Instance, we all go to work, we have to pay bills, we have to provide, and this is a time where babies still don't understand that. So when you leave the house, when mom or dad leaves the house, baby has to process that feeling, and it's perfectly natural for them to cry when you guys leave because you're their entertainment. You're their love. You're the ones that they look for every single day.
Another instance of this is when you drop them off for daycare or preschool. As soon as you leave them there, they're probably going to start to cry. Especially if this is the first time you're taking them to preschool, daycare, or babysitter. It's going to be shocking. It's going to be scary. They're going to cry and get upset.
They will become shy and nervous when meeting a stranger. What's an instance that could be? Maybe when we're at the mall and people come up to acknowledge your baby, maybe a distant friend we haven't seen in a while. They come up, they know you, they're very greeting to you, but that's a stranger to your baby. They've never met them before. They don't know their smell, they don't know the way they talk, they don't know nothing. So they're a stranger. And it's completely okay if they're shy and nervous at that time until you give them permission to greet and let them be held, and maybe even a little bit of playing at that time.
It'll take a little bit of time for your baby to get comfortable around those strangers, even though they know you and they're your friends, but it's still going to take them a while to get comfortable. You may still have your 12-month-old bury their head into your hip or hug you, look at them from a distance.
One last thing is, maybe at this time, your baby might show fear in some situations. Fear could be like going to a doctor's office, not knowing what that doctor's office is. We all know that when we go to a doctor's office, the baby's obviously going to be their checkup, but also possibly a shot. So that instance, they're going to be a little bit of fear. But the more that you keep going, the more that you acknowledge that this is normal, the more they should be adapt to it.
At this point for your 12-month-old, in language and communication, they're going to start to respond to simple spoken requests. You may say, "Where's mommy? Where's daddy? The ball? Where are your shoes?" Or, "Give me some? Can I have?" They're going to look at you and respond to those requests. At this point at 12 months, your child should be saying mommy, dada, and using exclamations like "uh-oh" or "wow" more consistently.
Yay!
Bravo! Things like that. Your 12-month-old may also start to try to imitate or repeat specific words that you're saying. Maybe not the full clear word, but if you're saying things like water, maybe they're going wah wah.
Switch into movement for physical development.
You caught me off guard there.
Good. Just like the babies catch our parents off guard.
Yeah, exactly.
So talking about movement and physical development, at this time, at 12 months, your baby should be able to sit up by themselves without help. Now, that can be an emerging skill. When we say 12 months, think of it the whole month that when they turn 12. Not just exactly when they turn 12 months, but in that range of 12 months, okay? You should be able to see them pull to a standing position. Maybe even holding on to some furniture and doing some
Cruising!
That's what we like to always refer to as. Where they walk around the furniture, or they might even cruise the wall. It doesn't have to be furniture, but they cruise the wall.
Something firm that they can hold on to, and that way they can go cruising.
And now I know all of our parents have these pack-and-plays. They will cruise the pack-and-play before you see them cruise furniture, so just keep an eye there. It's a very good
pack-and-play?
A pack-and-play is like a playpen, what we know it as. It's very common. It's very easy to take it to our relative's house when this whole coronavirus is done. And please just don't use it to just put the baby in and for you to mop or clean. That's not something it's for. But a lot of families will use a pack and play, and you'll see them.
The majority of families use it for that.
Right. So we try to just encourage them not to use it in that manner. It's more for them to explore in a safer environment, not for them to be withheld or encaged, confounded into one area, which would not be recommended for them to explore and learn. So,
but if you do that, hey, you do you.
Hey, you know what? We're not going to judge you. If that's the way you like to flow, that's the way you like to flow. Mm-hmm. But also another pinpoint as far as physical and movement, your baby may take a few steps without holding on, is where you start to see, once again, like I said, that 12-month range. Not thinking on the day that your baby turns 12 months, but in that range of 12 months, you might see them take a few steps without holding on to anything. Mm-hmm. And As they build more muscle strength in those legs, they are going to be able to stand alone by themselves.
But always be careful and watch over them. You never know when they might have a little tumble. At this point for your 12-month-old, for cognition, which is their learning problem-solving skills, you're going to see them explore everything. Now that they're going to be more mobile, they're going to get into areas of the home that you may not want them to get into, but it's all normal.
You should start seeing them bang two items together, making lots of noise.
This is also a noisy point in their development.
They're processing this noise. So they're realizing that if they grab two pans together and slash them together, it's going to make a loud noise. You might see uncommon things that they bring together and make noise with. So don't feel to redirect them. Let them explore that in a natural environment.
Just let them be free. I mean, that's how they're learning. They're learning through cause and effect. And right now that they know how to bang two things together, there's going to be a lot of those moments where you're like, shh, be quiet, don't do that.
And that's where we're like, no, let them.
Let them do it.
Let them explore. It's okay. Those are old pans. You'll get new pans next Christmas. It's all right.
Exactly. Now that your 12-month-old's more mobile, you're going to try to hide things from them that you don't want them having. Or you just might want to hide their pee-pee, their bottle, their pacifier, things like that. But they're going to be able to go look for it. They're going to find it, and then you're going to have to re-hide it again. So keeping things out of sight may not be that easy anymore because they can find it.
Now it's a skill for them. It's a skill for them to look for things.
It's a game.
And that's perfectly fine too. You know, hiding it from them, and if they do happen to find it, you know, maybe reward them with something else other than that item that you're trying to hide from them. But, you know, it's your call. You're ultimately the parent and you make that judgment call there. One of the other things that your child might be doing very successful now is pointing and poking with their index finger.
So they're going to be pointing things that they want, especially if you try to put it out of reach. So if you move their sippy cup, their bottle up too high, they're going to be nagging for you, and they're going to be showing you exactly what they want with this finger.
Now, if your child isn't using their index finger or pointer finger, you can influence them by giving them a visual. This is something I like to give all my clients and parents. For example, if the kiddo is using all four, or maybe even their thumb, which their thumb and exploring is more for like infants, we really want to see at this age from 12 months in that more of that pointer finger, index finger. So if your child is having trouble with that, give them a visual, you know, pointer finger, where are you?
This guy is singing.
So I always like making different songs to help me remember to give you these strategies.
A good way to work on pointing too is while you're looking at pictures in a book, you can name a specific picture that you see and having them point exactly where it's at. You can model it for them too. If you don't want to sit and look for books, or if your 12-month-old doesn't like looking at books, just do things around the house. Where's the TV? Where's the front door? Where's your doggy? And then model to them that pointing. It's going to go a long way in their development.
Now, an adaptive way to that, if your child doesn't like books, is having a hard time during story time, one thing you can do is if you have an old photo album book or single photo album book, you can have pictures of their favorite items around the house, like Alex just described. You said the door. What else did you say?
TV.
The TV.
You might want to throw the tablet in there.
Tablet in there, their sippy cup, their favorite toy that they like to play with during the day. Also, you could throw pictures of mom, dad, sister, and baby so that you can have them identify. So what you're doing is you're simplifying that task into a more of a preferred, fun task for them. And of course, let them flip the pages, you know, back and forth. You're just going to narrate what you see them doing and let them, that's when you engage and have them, where's daddy? And see where they point to
See
daddy.
if they're going to point to it. Matt.
And you definitely want to influence them using
this finger.
Pointer finger.
And this guy's bringing out all his tricks out for you. So note them down, take them down, copy them, steal them, make it your own.
And I advise you to make it your own because the more that you make it your own, the more valuable it's going to be to your child.
So we appreciate you watching. Please like, subscribe, and share. This is 12 months. This is where things really start to get going for your child, for your infant. They're no longer going to be just sitting, laying, pooping. They're going to be doing so much more now.
And it's good for them to explore. So don't think that, oh my goodness, 12 months is a handful. No, at this point, a whole 12 months of the brain has started to develop, and it's only going to increase to get bigger. So you want your baby doing these things.
Thank you.